AF ablation is a special technique which is a form of keyhole surgery that heart rhythm doctors do to treat people who have AF and continue to have symptoms despite trying medicine. It usually involves passing a few electrical catheters from the blood vessels in the leg up to the heart, and the doctor will then look for the abnormal electrical signals in the heart that are triggering AF. Usually in most people we know that AF comes from the pulmonary veins, which are the blood vessels that drain blood from the lungs to the heart. So the technique involves making some electrical burns around the veins in pairs. There are usually 4 veins, 2 pairs of each vein. The doctor will then check that they have completed the electrical lesions correctly, and then usually test to check that they cannot induce any more AF after the ablation. Before having an AF ablation, the patient should have a thorough checkup by the doctor and include blood tests before the procedure, and also make sure that they are fully informed of the need and the benefits of the procedure. Then the doctor will usually do a CT scan or MRI scan of the heart to look in more detail at that part of the heart, the left atrium, that needs to be ablated. And usually the day before the procedure or on the day of the procedure, the doctor will also do a special test called a transesophageal echocardiogram, whereby we put a little echo probe into the mouth to look at the heart from behind in the food pipe. And that's just to make sure that there are no blood clots in the heart before doing the procedure. Usually the patient will come in on the day or the morning of the procedure, and the procedure will take place in the afternoon, lasting about 3 to 4 hours, depending on how complicated the case is. The patient usually then stays 2 to 3 days in hospital, and after they're discharged, I normally advise them not to do too strenuous activity for the first week and gradually get back to normal activity over the next month. Usually the doctor will keep the patient on blood thinning medicine for about 1 to 2 months after the procedure, because there's a small risk of blood clots in the first 1 to 2 months whilst the heart starts to heal after the procedure. AF ablation is much more effective than medicine to control the symptoms in people with atrial fibrillation. Usually I quote a success rate of about 80 to 90% for AF ablation for people with early stage or intermittent atrial fibrillation, also called paroxysmal atrial fibrillation. Some people do need to have more than one procedure because there is a 10 to 20% chance of recurrence. With medicine for atrial fibrillation, the success rate is only about 40 to 50%. So putting the two together, AF ablation is more effective, but it does require a small operation, and there's a small risk associated with that. AF is very, very common, and some people with no symptoms can still have AF. It's important that it's picked up and diagnosed and treated correctly by the doctor, because it can be associated with very serious problems such as a stroke or weakened heart muscle. If in doubt, if you have palpitations or you're not sure, or you have risk factors, it's better to get checked out and check whether or not you have AF that needs treatment.